Have you been told you have orthostatic hypotension, or when you go from laying or sitting to standing, you get a little lightheaded, you get faint, you get dizzy, or you feel weak? If so, those are symptoms of orthostatic hypotension. So basically what happens with this is when you make those changes, you do not increase your blood pressure appropriately, and your blood pressure actually goes down, leading to the issues that you're dealing with, right? So you're typically getting a drop of greater than 20 over 10, so 20 being the top number, your systolic, and 10 being the diastolic, right? That's going down more than it should. So what typically medically are they doing? Well, they're treating it like it's a cardiovascular-based disorder. They're going to tell you to increase your salt intake. They may give you mitodrine. They may tell you to do compression stockings. They may ultimately have you do fludrocortisone. All these different things to try to increase your blood pressure, so when you make those position changes, you tolerate it better. But as you've probably realized by now, while it helps some, it is not actually a great solution. And it's because when we look at this, it is treated as if it's a cardio issue, and it is not. Okay? It is not a cardiovascular based issue. It is actually a neurological based issue. And this is where the frustration comes in, because the neurologists really aren't trained on this as well as they should be. So orthostatic hypotension, POTS, and other types of dysautonomia get shifted to the cardiologist, and then you've been there. What do you leave with? Frustration. So once again, this is a neurological based issue. Now I want to explain this, right? So there's a couple mechanisms by how this works. One is called your vestibular sympathetic reflex, and then the other is through baroreceptor responses. This is critical to understand. So, because there is research that shows there's very strong association between vestibular sympathetic reflex and orthostatic hypotension. Now, what we need to realize, right? So when we look at this model of the brain, okay, you have your brainstem. You have your top, you have your middle, and your bottom, okay? So this is mesencephalon, or your midbrain. This is your pons. This is your medulla, okay? Now, if we split it geographically for function, more parasympathetic down here, sympathetic up here. Now, the way the vestibular sympathetic reflex works, it's when you make positional changes, your vestibular system, which has all of its nuclei, basically right in here, it's going to respond, and it's going to fire down, leading to increased contractions, right? And to shrink the diameter of your blood vessels, so you maintain adequate pressure, so you do not get lightheaded, dizzy, and feel like you're going to faint or going to pass out. So that's critically important to realize, right? There's way more to the vestibular system than inner ear crystals. That's a peripheral issue. That is not a central. So a lot of people that actually have central-based vestibular issues when we look at orthostatic hypotension, and that's why we see them respond so well when they get care. So that is one thing. Next is baroreceptors. So when you make this position change, right? If you have orthostatic hypotension, what's not happening is you have less pressure against your arteries. Now, pressure stimulates those baroreceptors, which then sends information to your ventrolateral medulla. When your brain is like, we're not sensing a lot of pressure here, what's going on, we're not getting a lot of feedback, it then should fire down to say, let's constrict the blood vessels because we need better pressure. This, unfortunately, is not working appropriately in many individuals with dysautonomia, orthostatic hypotension, right? But the opposite should happen when you have too much pressure. That should also fire in, and it should say, oh wow, man, there's a ton of pressure. We need to widen these arteries so that we can feel okay as well and not have that much pressure. So I hope this is making sense, right? So that's the way your baroreceptor response works. Now, it's important to realize that when we look at the vestibular sympathetic reflex, your vestibular sympathetic reflex is very much impacted by your vestibular system. So this is ultimately how you interact with gravity. So transitioning forward or back, side to side, going from laying to standing, right? You get different vestibular organs that become activated, and that feeds in. But your vestibular system also doesn't live in isolation. There are influences from your visual system that influence your vestibular sympathetic response. When was the last time you had your eyes checked when you were dealing with this? And when I say eye checked, I'm not saying you need a new prescription. When was the last time someone put goggles on you and watched what your eyes did? Looking at stationary targets, tracking targets left and right, up and down, shifting your attention from one side to the other. When was that done? Well, in my experience, in over 99% of people, it's never done. But why not? Well, unfortunately, this is still being researched. Most people are not looking at the latest research and trying to piece it together. And that's what I'm doing here is I'm looking at the research, combining with the clinical experience I've gained over 10 years helping people to really piece this together. Now, it should be noted, right? Vestibular system, key part of vestibular sympathetic reflex. We said visual system is important. We get cervical spine is important. But then there's other things as well outside of this that can impact it, where we look at metabolic. So this can be immune system issues, this can be thyroid, this can be anemia, this can be blood sugar, right? So all of these things are going to impact the integrity of your vestibular system, right? So it's not just vestibular function, it's what's going to ruin vestibular function. And this is where people tend to miss the boat. They're trying to find the one thing. And what I found when you deal with chronic issues, the more you try to find the one thing, the less likely you are to get anything. Okay? You're not going to get the results you want. And this is why it really does require a holistic and comprehensive plan where you evaluate both the health of the brain and the body, not one or the other. And you've got to figure out what makes it work. So I get plenty of people with orthostatic hypotension or POTS or dysautonomia, right, where we're doing neurological rehab to address their vestibular and their visual issues. But then on the other side, we have to do things with their anemia. We have to do things with thyroid replacement, maybe even hormone replacement therapy with estrogen or testosterone, right? But then we may have to rebuild their gut. And what do you know, right? They've got chronic allergies too. Maybe they've got mast cell activation syndrome on top of it. And you're probably thinking, wow, this is really complex. And you're right. It is complex. So imagine if you got 3 to 5 things going on and a provider's just trying to find the one thing. Are you going to get better? You're not. You know, you've already experienced it. But for some reason, we've almost been kind of conditioned to think like we go in, we know we've got all these issues, but then we keep hoping someone will sell us that one magic bullet. And I just want you to go, what's your experience been with that? You don't get results. Let's just be honest. You don't, right? Are there some people who get lucky enough if they do the one thing? Yes. But for most, when we add things together, we identify how the nervous system is functioning, and we identify what's going to prevent it from functioning as well as it should. That is how we treat orthostatic hypotension and other types of dysautonomia and POTS here at our clinic in Wesley Chapel, Peak Brain Body. Next time, I'm Dr. Z, and I'm known as the Brain Guy.